Hello and welcome. As we get started this morning, I want you to wax a little nostalgic with me for a moment and think back to being a kid. One of my favorite memories was Saturday morning when it was me and my brothers, my bowl of cereal, and our Saturday morning cartoons. Somewhere between Bugs Bunny and Scooby Doo, they would sneak in a little educational content. If you think you know where I'm going with this, put your guesses in the chat now. We'll see if you're right. The cartoon I'm thinking of specifically originally aired all the way back in 1976, so I got to see it in reruns. And it featured a rolled up piece of paper sitting on the steps of Capitol, waiting to become a law. Any guesses? I see some of you might remember. The show I'm referring to is Schoolhouse Rock, and the episode was I'm Just a Bill. Some of you may even be humming along with the song right now, and some of you might have to Google it after today's session. Love that show. Yes, me too. Anyway, my point is, even as a kid watching that cartoon, I thought, wow, this legislative process is really long and complicated. And now, fast forward all these years later, and I still think it's long and complicated, especially if you're a self funded employer. But one thing they didn't tell us in the cartoon was you don't have to just sit around waiting for things to happen. You can prepare, you can adapt, and in some cases, you can even influence legislation. Hi, everyone. I'm Jennifer Austin, Senior Director of Strategic Partnerships, Innovation, and Marketing here at the Alliance. I'm excited to be talking about health policy and legislation and the legislative and regulatory issues that will impact all of us in the weeks and months ahead. Our goal today is keep it simple. At the end of today's session, the three things I want you to take away are an understanding of the key legislative issues that are already enacted into law and how they'll impact your self-funded health plan, the upcoming issues that could benefit your business and your employees if they become law, and how you, as an employer, can help influence health policy issues that are in the best interests of your businesses and your workforce. Having said that, however, I want to be clear. The Alliance's mission is to move healthcare forward by controlling costs, improving quality, and engaging individuals in their health. When it comes to legislative initiatives and what we choose to support, we base our decisions on how we can bend the medical cost trend. If you've been attending our events regularly, bend the trend is a term you've probably heard us mention many times over the last year. Our main objective is to achieve lower healthcare costs together. So when it comes to health policy, we want to make sure the things we support contribute to bringing down the overall cost of healthcare. Before we get started, I want to remind you to use the chat box to ask your questions. We'll answer as many as we can at the end of today's program. And use the emoji buttons to let us know what's resonating with you. To access additional resources, click on the resources box on your screen. And the recorded video of this event will be made available on the events page of our website as well as our YouTube channel. We'll email a link to all attendees next week when it's available. Finally, I wanted to take a moment to thank Delta Dental, National Cooperative RX, and MH Imaging for their ongoing sponsorship this year. To learn more about how each of these partners can help your self-funded plan, click on their links in the sponsorship box on your screen. We really appreciate their support. It allows us to continue bringing these valuable programs to you, our employers and partners. Today, I'd like to welcome two friends of the Alliance. I like to think of them as our real-life Schoolhouse Rock cast. They're here to help us understand and make sense of what's going on so you can prepare, adapt, and hopefully influence current policy. With me today are Ilyse Schuman, Senior Vice President, Health and Paid Leave Policy at the American Benefits Council, and Melissa Duffy, owner of Duffy Communication Strategies. Welcome, and thank you both for joining us today.
Thank you, Jennifer.
Thanks. To give you a little background on today's panelists, I'll start with Ilyse. As I mentioned, she's the Senior Vice President for Health and Paid Leave Policy at American Benefits Council, where she leads advocacy on key healthcare and leave issues. She's a top former congressional staffer, having served as Chief Counsel on the Senate Health Committee. She also worked in law, business, and policy, most recently co-chairing the Workplace Policy Institute at Lederer Mendelssohn. Welcome, Ilyse.
Thank you.
Next is Melissa, who brings deep experience in health policy and advocacy to her work with healthcare purchasing cooperatives like the Alliance. She previously advised the Wisconsin State Senate on health policy and later championed cooperatives in the private sector. Her background spans government relations, media, and consumer advocacy. Welcome, Melissa.
Thank you.
As we get started, there are 3 areas we'll be focusing our conversation on today: the impact of health policy at the federal level, the impact of state actions and how they both impact your business and your employees, and what actions employers can take to get involved and make a difference. Melissa, I'm going to start with you. Why does staying informed matter, and why is it important for employers to pay attention, especially now?
Thanks, Jennifer. Yeah, it's really critical right now to be paying attention to health policy because we are at a crossroads. 15 years ago, Congress passed the Affordable Care Act, which was not designed to reduce prices. In fact, many economists believe it accelerated price increases by accelerating health industry consolidation. Price transparency and data access issues that we'll be talking about later today reflect the reverb from all of that, the pushback from purchasers. And we see employers increasingly making it their priority to protect working Americans from higher prices through ideas like value-based benefit design and network designs. And it's getting the attention of lawmakers at both the state and federal levels who are now more acutely aware that something has to be done about prices and the competitiveness of the market. And if we're not paying attention, we're going to miss this significant opportunity to advance healthcare in ways that protect employers and employees. One of my favorite things about Schoolhouse Rock was the part where the legislator turns around and types the bill. That's not really how it happens, guys. And it's our job to amplify your voices so that the people who do write those bills are really paying attention. But we can't do that when employers aren't engaged. This is a big ship we're trying to turn, and we need all the hands on deck.
That's great. Thanks, Melissa. Elise, anything to add?
I could not agree more that it's a big ship and it's going to take all hands on deck to turn it. And just, from an overall sort of landscape, I think there's a lot of questions about employer-sponsored coverage by policymakers, the future of employer-sponsored coverage, the value of employer-sponsored coverage, as employers themselves are facing, increasing costs. And if employers need to be part of the solution, and to be part of the solution, they have to make sure their voice is heard. And I do think that we are at a pivotal point in health policy more broadly, and employer-sponsored coverage more specifically. And really, I think for the first time, after a lot of groundwork that has been laid over the last couple of years, really some traction in these policies that are going to help employers make healthcare more affordable, higher quality, and value-driven for employees. But that is not going to happen in silence. The employer voice is a critical stakeholder voice to add to that debate.
Great. Thank you so much. Let's start by focusing on the federal level. Elise, can you give us a high-level overview of the environment in DC right now? What has changed since President Trump was elected?
Sure. Well, first of all, love the shout out to Schoolhouse Rock. So let's talk about Schoolhouse Rock, 2025, not, 1975. And a lot has changed about, the legislative process more, I think, generally, but specifically, since we have seen, President Trump and Republicans controlling both the House and the Senate. And I think what has changed most dramatically, and that's not just with this administration and this Congress, but that when you have a White House and both houses of Congress that are controlled by one party, you see big policy changes like the ACA, for example, like the 2017 Tax Cuts and Jobs Act, happen through what's known as the budget reconciliation process. And so that's a little variation that I don't think Schoolhouse Rock quite, captured. And effectively, what that means is that, one party in control of the White House and Congress can push party line policy through Congress without the other party. And that's what we just saw. And that's what's been most of the energy is the OB3, the one big, beautiful bill act that recently, the Republican bill that passed through Congress with a whole lot of issues and priorities for Republicans, including some important policies for employer provided plans, some things that were in there, some things that were not. But I think that's also sort of changed the dynamic about, okay, what's going to happen for the rest of the year. That was a very, party line, partisan exercise. Now we're in the middle of questions about, is the government going to be funded, or the lights going to stay on after September 30th? And that's going to need some bipartisan work for Republicans and Democrats to agree in Congress to do that, if they can do that. So while there's a lot of, and then I think getting beyond that, looking to see whether there are opportunities again for bipartisan work on the things that we talked about and some of those healthcare policies that we talked about, really at driving down healthcare costs and improving value. But, also we have to look at what's going on at the regulatory side of the equation. And, certainly we have seen a big shift in priorities and policies under the Trump administration from the previous administration. I think, looking at reversals of some Biden era, policies, for example, on the mental health parity regulations. So those are on hold and are going to be revisited. And I think, more generally, less of a focus perhaps on enforcement, more of a focus on, compliance assistance. But even in that, even in a shift of policy priorities at the regulatory level, and as things get more difficult to push through Congress, I think the administration is going to see what they can do through the regulatory process. There are some of the things that we really care about, like transparency and enhancing competition, lowering healthcare costs, that can be pursued through the regulatory process too. So, Schoolhouse Rock 2025, not easy to summarize in a 30-second cartoon, but there's a lot of dynamics at play.
Thank you for that clarification. And we know that Trump has issued a lot of directives. Can you tell us the status of those that most directly impact our employers?
Sure. Well, I think a lot that are very much in the sweet spot of some things that employers care about. One of which was promoting healthcare transparency, more transparency in healthcare. And this was actually something that in the first Trump administration was a very important policy in laying some important groundwork for healthcare price transparency in both the hospital pricing rules and also new price transparency requirements for group health plans. And now this directive, this executive order for building on those efforts to increase price transparency in healthcare, strengthening a hospital price transparency requirement, revisiting some other things. And that actually, is something where I think there's, bipartisan support in Congress for that, and also in the, the regulatory action. So I think that's one thing that we certainly have our, our sights on, and seeing how we can shape and give more momentum to those efforts, while at the same time continuing to push Congress for legislative action on that. Also, we saw an executive order on lowering prescription drug costs, something, very important and top of mind for employers. So, these executive orders were not rules or regulations. They weren't legislation, but they did direct the agencies to take certain actions. And so we're just starting to see some of those things rolling out now. Also, I think another important executive order was an effort to try to streamline regulations, deregulate, remove unnecessary or overly burdensome regulations. So I think we're seeing, that happening at the same time as we're seeing a focus on some of the things like, transparency, lowering prescription drug costs. Also, I think just a very different approach to the view of government in regulations.
Thank you. And you mentioned previously that one big beautiful bill, it made its way past Congress, it got signed, it's now law. Can you give us kind of a quick overview of what everything is in the bill and what it might mean for employers and employer benefits?
Oh my goodness. Well,
There's a
it's a
lot
big
there, I
bill.
know.
It's a big, beautiful bill act. So without going into, the full scope of the bill, because I know there's a lot of different, perspectives and constituencies that were, impacted in different ways, by that, including some of the, changes to to Medicaid and, other tax provisions in there. So I'm just going to stick to, what was in the employee benefits lane directly, although, certainly some of those other changes can, have indirect and impacts on employer provided coverage. But, let me just start by what was in there that I think was really important and a priority that we at the council had been pushing for quite some time. And that is some provisions to health savings accounts, allowing more flexibility for HSA eligible health savings account eligible high deductible health plans to offer what we see as really important high value coverage, specifically the ability to cover telehealth on a pre-deductible basis. This was, a policy that began during COVID. It had been extended several times, unfortunately expired at the end of last year. We had heard from our employer members how important and how critical that was to, for example, being able to expand access to healthcare, particularly mental health care, and in rural areas. And fortunately, after I think a lot of advocacy, that provision was made permanent. So employers don't have to keep wondering whether or not that policy is going to be extended from year to year. And I think that's going to have an important impact in really trying to embed telehealth in benefit offerings and how to use, telehealth to expand access to care in a value-based way. Also, another provision in there creating more flexibility for HSA plans was a provision that allows for pre-deductible coverage for direct primary care arrangements. Again, really hearing a lot from our employer members how primary care services are high value services, and this would allow pre-deductible coverage for direct primary care services that are paid on a fee basis with a cap to those fees. So those are really important provisions that were included in there. We were also very glad to see that there was a provision that was not included in there that would have, for example, capped the tax treatment for employer-provided health coverage. We had heard from some very influential Republican voices that was, potentially on the table. And, any sort of limit or cap to the tax exclusion that employees have for employer-sponsored coverage or the tax deduction for employers would have been really, devastating for employers and working families. And so we worked very hard, both behind the scenes and a little bit, in front of the scenes to make sure that that was not included. And fortunately, it was not included, but as part of that debate and, was a real question about and a concern and focus on the affordability of employer-sponsored coverage and costs for employer-sponsored coverage. And as we said, that wasn't the way to try to drive down costs by increasing taxes for working families, but we do have to be looking at other things to really address affordability and lower healthcare costs. Also, there are some other things that we were hoping to get into the bill, the OB3, I'll call it, that would have, provided I think some of the policies to lower healthcare costs by increasing transparency and competition, like site neutral payment reforms, those didn't make it into the package. And some of those other policies that didn't satisfy the very stringent sort of legislative requirements to be included in a reconciliation package, didn't make it in. So we still have our work cut out for us there. But I think some important provisions that were wins for employer-sponsored coverage, making sure that the employer, the tax treatment wasn't changed. But again, I think there's still a lot on the cutting room floor that we need to continue to focus on.
Great. Do you know what we can expect for the remainder of this congressional session? I know it's a lot to ask to look into the future, but
well, great question. I think that's what everyone is wondering right now, particularly as the clock is ticking down at the expiration of government funding at the end of this month. And so, I think right now the question is, what's going to happen? Is Congress going to come to some sort of short-term agreement to extend government funding? I think a big question surrounding that is the expiration of the ACA's enhanced premium tax credits at the end of the year. That's a real top priority for Democrats to make sure that those are extended. And I think that's going to be the price to pay for any sort of agreement to extend government funding. And on the Republican, side of the aisle, they have such thin margins that it's going to be very dicey and difficult to, cobble together that sweet spot in the next couple of weeks. And whether or not there's a government shutdown, we'll jury's still out on that. We'll have to see how this plays out. And if Congress does agree on at least, are they going to agree on a short-term extension of government funding, which would tee up another opportunity at the end of the year for a bigger package for some of the health policy priorities that we've been talking about that are really bipartisan policies to hitch a ride to. So I think when we look ahead to the end of the year, certainly I think we're going to see, a lot of committees maybe refocusing on some bipartisan, healthcare affordability, transparency, competition issues. But it's going to be a question about, is there going to be an opportunity before the end of this year, a vehicle for those policies to be attached to? And that's going to really play into, I think, much bigger political dynamics at play.
well, thank you so much. I appreciate it. I'm going to switch gears now. I'd like to focus on what's happening locally at the state level. One thing we've learned over the years is that when employers are engaged, especially here in Wisconsin, that's how we've been successful. Melissa, can you tell us a little bit about the environment today in Wisconsin?
Sure. Well, right now in Wisconsin, we have a Democratic governor and a Republican legislature, and they are nearly always at odds, which reduces the number of substantive bills that get passed and signed into law. But they did just recently work together to agree to a 2-year state budget bill in a rare show of bipartisanship. And then shortly after we saw the white smoke rise from the chimney on the budget bill, Governor Evers announced that he would not run again, meaning we're going to have a very competitive race for governor in our state in 2026. So that environment could dampen a whole lot getting done for the remainder of the session, which lasts until early spring of 2026. So that can work for us and against us, since there are some important ideas we would like to move forward proactively. And then there's also legislation we'd like to see die. So I'm looking to Illinois, if there's some folks from Illinois on the call. That's a different environment. Democrats are in control of everything in that state.
Is there anything you can tell us about the Wisconsin budget bill that just got passed that we might need to know?
Yeah, there was something big that got done for employers in the budget bill. We have been advocating for some time on a workers' compensation fee schedule. I would call this a tenuous version that was signed into law as part of the budget, and it doesn't go into effect until July of 2027. And it only applies to hospital services and not to other healthcare services. So it's really only a start, but it is something we can build upon potentially. And I need to warn everyone, it only goes into effect if the hospitals get a certain amount of increased federal funding through something called the hospital assessment or hospital tax, which is an unknown right now. So it's possible that the fee schedule could not be implemented. This hospital assessment is something that is important to explain because that also impacts employers, and it's kind of antithesis to how it sounds. It's a process by which the state taxes hospitals, which you wouldn't think they would support, but they do, because they then are able to put up these dollars and get a lot more federal match back from the federal government, and then it is paid back to hospitals and higher reimbursement rates. So the tax is actually good for most hospitals because it funds an increase in reimbursement rates, and on the Medicaid side, I should say. And the net effect in Wisconsin is going to be an extra $1 billion in Medicaid payments for hospitals in each of the next 2 years of the biennium. So it's kind of a big deal for hospitals, which obviously impacts us. But this was all done at the last minute. It's not perfect. So we need to be watching closely as to how this gets implemented.
Great. It's a start, right? Melissa, are there any bills outside of the state budget that legislators are considering now?
Yes, it's been a very busy session for healthcare. One bill I feel the need to close the loop on, because I've spoken with probably some of you on the call about this, is the direct primary care bill. The Alliance, Advancing Free Market Healthcare, and employers in general strongly support that bill because it clears a regulatory hurdle that direct primary care providers face related to the applicability of insurance laws. And we worked very hard to get bipartisan support for the bill. And I'm happy to report that it was passed by the Assembly on a voice vote, meaning that no one objected to its passage. But unfortunately, the governor vetoed it anyway because he felt strongly that non-discrimination language should be added to the bill. I'm hopeful this bill will come back next session under a new governor and we can finally see it pass into law. We also saw the introduction of a PBM reform bill, which is Senate Bill 203. And PBM reform sounds like something we might like, but it doesn't include provisions that employers support, like full transparency for PBMs or a ban on spread pricing. And I have to give a shout out to our friends in Illinois on this one because they passed a PBM reform bill that, while not perfect, at least includes transparency and spread pricing provisions. The ban on spread pricing in Illinois means the PBMs will not be able to charge employers more for a drug than what was paid to the pharmacy. So that's why that's so important. The Wisconsin bill, on the other hand, I would say hampers competition by restricting employers' ability to put high-value pharmacy configurations in place. And it stops us from incentivizing our employees to use mail order, which many employers are using for international sourcing of medications. It also requires PBMs and plans to count the value of drug coupons toward deductibles and out-of-pockets, which shields consumers from exorbitant prices, while pharmaceutical companies, I will just say, really price gouge employer plans. And we would no longer have the ability to remove expensive drugs from our formularies as soon as less expensive alternative medications are introduced. So we'd also like to see that changed if this bill should move forward. We'd have to wait till the end of a plan year to make formulary changes that could save our plans a lot of money. And I guess, just in my opinion, the whole bill is very anti-free market. It eliminates market incentives to keep list prices lower. And we've heard a lot of concerns from employers about how much this would cost them. So that's a big concern for us. In better news, we also saw the introduction of a new and improved hospital price transparency bill. And that bill gives the state authority to enforce federal hospital transparency regulations. And it also puts a backstop in place in case the federal regulations are ever deemed unworkable. So that makes it more likely that we can rely on transparency requirements in the future. And it makes a lot of sense because, as I talked about, the workers' compensation fee schedule will be predicated on machine readable files that the hospitals and insurers and health plans are required to post. So we really need to ensure that those are accurate. Illinois actually took transparency another step forward and passed a bill that was signed into law that requires hospitals to disclose facility fees to patients. So that's another positive for our friends down south.
Well, you talked about quite a bit. Are there any other big issues for state legislators during the last half of the session?
Yeah, so now that the budget's passed, state legislators took a little break, and now they'll be coming back and working very hard over the next several months on the last half of their session. So through Advancing Free Market Healthcare, Wisconsin employers are working with the legislature to draft a data access bill, and that will complement the Employers Deserve Price Tags Act at the federal level, which maybe we can bring up a little later with Elise. That bill stipulates at the state level that employers own their data, and insurers, TPAs, and others must turn it over to employers when it's requested. I have heard and I believe that data is the currency of the future, and we need to make sure employers are in control of their data. So I'm very happy to see this being introduced at both the state and federal levels. And the Alliance knows that access to data is the foundation to higher value health plan design. And that data analytics helps us identify the biggest cost drivers as well as the biggest opportunities to address costs. And I would encourage anyone in this meeting who hasn't heard one of the Alliance presentations on this to really go out and find that, or pay close attention to the next one, because it's really where we have proven that we can bend the cost curve. There is also a prior authorization reform bill that we've been talking to legislators about, and this is something that's very new. The bill is circulating for co-sponsors now, but I've been sharing information with some of our employers and our experts in the field, and we are going to have to pursue some changes to that bill to ensure it doesn't get in the way of the good work that employers are doing. And I also think we're going to need to play strong defense on the PBM bill and any other last minute legislation that we always see come up that will get introduced before the end of session. We've seen some bad ideas proposed in each of the last two sessions, and we have been successful in defeating those bills. But of course, we have to remain vigilant on those.
Well, thanks for bringing up that Employers Deserve Price Tags Act, Melissa. Elise, is there anything employers can do at the federal level to help push that across the finish line?
Absolutely, there is. And let me just say that, I think that this transparency, access to data is essential and foundational to employer efforts to lower the costs and improve the quality of healthcare. And I think employers need to be the ones that deliver that message. Lawmakers, policymakers, many of them don't understand and don't differentiate employers, or purchasers from health plans, from other payers. And so I think it's really important for policymakers to understand that employers need this information to be able to make healthcare more affordable, higher quality, higher value. And nothing is as impactful as when a policymaker, a lawmaker hears from an employer and an employer with, a footprint in their own district or state. And so there's a lot of bigger, broader coalition efforts that Melissa and I are part of, where, adding the name of the organization makes a big difference, but also some of that individual, employer outreach to your lawmaker, your representative, your senator, to let them know that this is important for you, your business, and your employees.
Great. Melissa, anything that employers can do to help this across the finish line at the state level that you haven't already touched on?
Yeah, I would strongly suggest signing up to be a member of Advancing Free Market Healthcare so you can join our conversations directly with legislators. Some of you might have heard what Eileen just said about getting involved and thought, how do I do that? Well, this is the easy button. We've created this, and we're making great progress on our issues. So it's clear to me it's effective and legislators are listening. And if we build this strong movement around free market, value-based healthcare, it's going to be real hard for lawmakers to say no to it. And I just want to give you one example. I talked about the concerns with the PBM bill just recently. Well, we have laid out a letter outlining those concerns for lawmakers, and I currently have multiple employer logos on that letter, employers who have agreed to sign on. So it's a really easy way to do something extremely effective to change the direction of healthcare policy in Wisconsin.
That's great. Are there any other ways that employers can step up and make their voices heard in addition to working with advancing free market healthcare?
Yeah, well, they can run for office. That would be great. But if you don't want to do that, I mean, I've mentioned just taking a few minutes. I'll talk about advancing free market healthcare again, because it really isn't hard to do. You fill out a brief application on the website, which is advancingfreemarkethealthcare.com. And when you do that, you can see that you can really customize your level of engagement. Maybe all you want to do is send an email to your lawmaker to start the conversation, and that is important. We heard that loud and clear from Representative Bob Wickey, who joined us for the Alliance Spring Symposium. He talked about how even one voice can be effective. So you multiply that by 10 in each legislator's district, and you really have a grassroots movement that is almost unstoppable. And we have a way to go before we get there, but if you really want to engage and make your voice heard in a bigger way, I would encourage you to join your colleagues in advancing free market healthcare, and then check the box to host or attend a regional meeting with lawmakers, because those have been very, very important and effective ways to talk with legislators.
That's great. And the Advancing Free Market Healthcare website is in our resources box as well. Elise, is there anything you want to add when it comes to the federal level?
I think the same things apply at the federal level. I think it's just that outreach, whether, it's an email, it's a phone call, to your lawmakers, your representative, your senator's office. It's, signing on, having your company or organization sign on to one of these letters supporting, some of the bills that we've been talking about. It's, I think, particularly when, these lawmakers are back in their home states and their home districts, showing up at events and, again, it doesn't have to be a lot, and we can make it easy for you, but just making sure that that there is an employer face to these efforts too.
Mm-hmm. Absolutely. I can hear you're both super passionate about this, but I want to emphasize what you both said. It's not about you, Eileen, or Melissa doing this. It's not even about what the Alliance is doing. We need employers involved. We really need everyone listening, getting involved, and reaching out to their legislators. As I said in the program, our main objective is to achieve lower healthcare costs together, and it really does take all of us. This has been a great discussion, and I know we want to keep it going. So we're going to start with just a few questions that we've received previously, but if the audience could go ahead and start to put questions in the chat, that would be great. A couple key takeaways before we get to some of the previously submitted questions. We want to recognize the impact of those federal actions and congressional activities. There are a lot of big things going on right now, initiatives that have been implemented and considered at the federal level that are likely to advance. So the key to success is for employers to use their resources and stay involved. I think we really touched on the ideas at the state level. There's a mixed bag for employers, and some aren't yet law. These in particular can impact the cost of healthcare and employer flexibilities in designing those benefit plans to address cost and quality. So the Alliance is supporting advancing free market healthcare, and we're working together to make sure that helpful policy initiatives are moving forward, but don't sit on the sidelines, get involved. We want you to embrace those opportunities. We know that employers making their voices heard is very impactful to shaping health policy. So, to those who submitted the questions in advance of today's session, thank you so much. We're going to start with those. For everyone else, if you could feel free to type those questions in the chat box, we'll get to as many as we can. So, the first question is, how do these changes impact self-funded employers, and is ICHRA still a viable solution? Melissa, can I start with you on that one?
Yeah. So I'm going to start by admitting my bias on ICRAs. And I generally think that they are a good choice for small employers that are not large enough to self-fund. But self-funding really is the way to go if you can do it. But the problem with ICRAs is that they are reliant on a healthy individual market. And right now, the individual market is really unstable as a result of the federal changes that Eileen talked about earlier related to the expiration of the enhanced advanced premium tax credits, and several other modifications that this administration has put in place. And so I'm not as bullish about ICRAs as I was a couple of years ago when the market was more stable. I don't know, Eileen, I know ICRAs are really a federal policy, and it seems like this administration is backing them. I don't know if you have anything to add there.
Yeah, I mean, I think ICRA's definitely a priority for this administration, to build on it, the rules that came out during the first Trump administration, and Melissa, as you said, I think, this has really been more of a focus or interest to smaller employers. So not necessarily, our members, but, as you also said, it's incumbent on a healthy individual market. And also, I think an appreciation that, employers perhaps somewhat reticent to have employees navigate what is a very perhaps complicated, complex, individual market. I think, also, I think there would be some concern with any changes to the current ICRA rules that would remove some of the guardrails against, risk selection, and, leaving, group health plans, for example, with sort of the sicker patients and having, the healthier patients, employees migrate to ICRAs in the individual market. There's guardrails that are in the existing regulations, but I think we'd be very cautious and concerned about any efforts to scale back those guardrails.
Yeah.
Great. Thank you both. Next question. What are 3 policy changes that could positively impact purchasers in the next 12 months? Eileen, do you want to start at the federal level, and then we'll ask
Sure.
Melissa
Well,
to
some
weigh
of the
in?
things, some of the things that we've been talking about for, I think, the last 43 minutes. Transparency, making sure that employers have access to the data, the price transparency. There is legislation, Price Tags Act, that's pending at the federal level. So, you don't fight this out at the state level. And certainly for ERISA self-funded plans, it's important to have that. So, making sure that price transparency legislation, PBM reform legislation, that we've been talking about. Again, that's also bipartisan. It made it close to getting across the finish line the end of last year in a bigger package that ultimately fell out. So I think still a real focus on PBM reform legislation. Also, some other policies really aimed at preventing hospital consolidation that's driving healthcare costs higher in higher cost settings, like site neutral reform legislation that would basically equalize payments that Medicare would pay for a hospital outpatient setting, and physician practices that have been purchased by hospitals and then rebranded as a hospital outpatient department. And so I think that could also be a benefit to the employer market as well. So I think all of those, transparency, PBM reform, some of this, site neutral payment policy and associated, requirements that hospitals are more transparent about their billing and, where site of services are delivered could be all really important steps.
Melissa, anything you want to add there?
Yeah, I would 100% agree with Elise's list. I would say that employer access and ownership of their data is extremely critical, and it needs to be recognized at both the state and federal levels. And we need to keep, price transparency moving forward. So 100% agree with both of those things. I think if I had a third one, it would be a very strong defense. I don't want to see us going backward in any way on, anything that increases spending or that reduces flexibilities. So the need to protect ERISA and make sure that we have a competitive healthcare environment and that we have flexibility for employers to design their plans, that is equally as important as the other things. And those are, it's both offense and defense that we have to be playing at both state and federal levels.
Yeah, and if I can just put another plug and emphasis on the state preemption and ERISA issue, because our employers, nationwide employers that self-fund, and ERISA's preemption provisions and the ability for these self-funded plans to design and administer their plans on a uniform basis nationwide is essential to their ability to efficiently and effectively and affordably offer health benefits. So we have seen, various states encroaching on that ERISA preemption and fighting like whack-a-mole all of these states that don't have an appreciation, or they may have an appreciation for it, but they're doing it anyway. And so we've been playing a lot of defense at the state level because without ERISA preemption, the task and ability of self-funded plans to continue to offer benefits, health benefits, becomes exceptionally more difficult, if not nearly impossible.
I have to add something to that. In fact, you can tell how important ERISA preemption is. Mm-hmm. And I have to say that, when Elise talks about some of the states where there's encroachment, Wisconsin is one of those states. Every bill that we see written is written in a way that is of concern when it comes to ERISA preemption. And, of course, we're in the legislature in informing them about the importance of ERISA preemption and how they are encroaching on this, and that it will probably end up in court if they decide to pass it the way it's written. But, in their mind, in the state legislator's mind, they're thinking, well, we want to regulate everybody. We don't want to just regulate health insurers. We want to really regulate all health plans. And so it really is a heavy lift on the education side. This is where Elise and I work very closely together, because the American Benefits Council is a great organization when it comes to providing resources about ERISA. And so definitely we need to be keeping our eye on that very closely. Thankfully, we've been able to, defeat those things so far. But, it's a fight we continue to battle.
Yeah, that visual Elise used of whack-a-mole was very visual. Just trying to battle it from every angle. Thank you both for that. I've got another question. You talked about advancing free market healthcare being an employer's easy button, but what's the best way to craft a message so that it resonates with lawmakers and gets noticed? Melissa, do you want to start?
Sure. Well, first I would say, and I'd encourage everyone listening to start building relationships with their state legislators. And you don't have to have something to talk about. They're accessible. And all you have to do is invite them out for coffee, or invite them to your office, and just, talk about what's going on in the legislature. So you start building these relationships. They're typically in their districts Monday and Friday. I'm talking about state legislators. Congress is a little more challenging. Their schedules are a little bit fluid, so you need to have some patience and perseverance when it comes to that. But as far as crafting the message, I will tell you that when you've met one legislator, you've met one legislator. They like data. A lot of them like data. And then a lot of them respond to emotional stories. So I realize employers don't have all the data they need yet, but you can use the data that you have to tell compelling stories that lawmakers will listen to. And then it is extremely effective if you can tie that back to a personal story about how it impacts your employees in real life. I would say that is the best way to craft an impactful message with legislators.
Great. Elise, anything to add?
Yeah, I think that we need to appreciate what messages resonate in the current political environment, and that the message is going to be a bit different depending upon what side of the aisle that you're talking to. I think that with respect to, Republicans, some free market Republicans, for example, feel like, well, why should Congress weigh in on some of these policies that impact the private insurance market? And I think the response to that, is that, that employer provided coverage, first of all, is sort of is the bulwark of against like having, a national single payer system. So if you want to try to preserve the free market and private health insurance market, you have to restore a fair, competitive, and transparent healthcare market. And so that, I think, plays in with the sort of free market arguments about, restoring competition and transparency to the private market. I think also, particularly for both sides of the aisle, it's important to really talk about this in terms of working families, because, employers may not be the most sympathetic audience. It's like, oh, yeah, this costs us more. This is more administrative red tape. But when you really talk about how, costs and making healthcare more affordable for working families and communities across the country, that I think is a more compelling argument, particularly, and I think, we're in more of a sort of populist, era and environment. So I think it's really important to focus on the impact of these policies on your employees and their families.
Great. We are starting to run out of time, so I'm going to ask one last question before we wrap up. Does the ability for CMS to negotiate drug prices hurt the commercial payer because of cost shifting by big pharma? Or will CMS negotiated prices trickle down to the commercial market? Oof, that's a big question. Eileen, you want to take a stab at it?
Wow. Well, I think that remains to be seen, right? I mean, what both may be true, and we'll just sort of see, how that nets out, in terms of, is there going to be cost shifting because prices are going to be lower for Medicare? Does that mean, the companies are charging the commercial market more to make up for that? Or, is the private market, is the commercial market going to be able to use those lower prices in Medicare to be able to negotiate lower prices for their own plans? And so again, I think I think that remains to be seen. But I will say that I think it's, really important to continue to focus on prescription drug costs and healthcare costs more generally, not just for Medicare and for seniors, but for employers and working families too.
That's great. Melissa, anything you want to add other than maybe we're hopeful it will help the employer market?
Yeah, I mean, I agree with Elise. I think it remains to be seen. I just think it is a perfect example of how we cannot look at specific issues in a vacuum. What happens in one area affects other areas. And unless we have the data and we're looking at the big picture, we're really not going to be able to evaluate those things. And frankly, that's been the situation for the past several decades. So, definitely something that hopefully as we get more data, we're getting more sophisticated about how we look at data. We'll be able to evaluate that better. And if it ends up having a detrimental effect, change it more quickly. I can always be hopeful about that. So yeah, that's what I would add.
Well, thank you both so much. That wraps up today's event. We appreciate you both taking the time today to share your knowledge and expertise with our audience on these very important topics. If you're an employer member of the Alliance and need additional resources, or if you're considering self funding and would like more information, please reach out to our business development team by scanning the QR code or using the URL you see on your screen. If you're interested in becoming more involved in health policy, I encourage you to engage with our advocacy efforts through our organization. We support Advancing Free Market Healthcare. To learn more, visit advancingfreemarkethealthcare.com or scan the QR code. We'd also love to meet you in person. We'll be attending several meetings and events this fall. You never know what opportunity you may uncover just by showing up. And be sure to register for our October annual meeting. It will be presented again this year in a convenient webinar format. At this event, our employer members will hear a quick update from our board chair and treasurer, and the Alliance president and CEO will share a teaser of what lies ahead in 2026. Be the first to hear what's happening. For a complete list of all the activities, check out our events page. Also, there's still time to nominate an organization for our 2026 Healthcare Transformation Award. Submissions are due October 17th. Scan the QR code on your screen or click the link in the resources box. Thank you again for joining us today. And remember, when you think of the Alliance, think self-funding smart. Take care.